everybody. My name is Charlene Margot, and I'm the founder and director of the Parent Education Series. We are now serving students in the Sequoia Union High School District and the Redwood City School District, Los Lomitas School District. So again, we are very grateful for our sponsors today that are helping us produce this program, the Sequoia Union High School District and the Sequoia Healthcare District. So thank you very much. Without this support, the program would not be possible. Today's event is a special one. We are having a short summer series this year because there's just so much to cover in terms of parent education. So we're very grateful to have with us today Dr. Margo Thienemann, who is here generously giving her time and expertise as we talk about anxiety today. And I know after 3.5 months at home, this is an issue that's impacting every family. So again, we're very grateful to her and for her time again and talent today. Let me start by saying, I know that many of you viewed the live stream of the film Angst, Raising Awareness Around Anxiety. So I'm going to start by just reading you a very brief description of the film, because we will reference this throughout this talk. If you did not see it, that's okay. We will plan to show it again in the fall, but it does do a nice job of summarizing the kinds of anxieties and the way that it impacts children and teens. Angst is an IndieFlix original documentary designed to raise awareness around anxiety. The film includes interviews with kids, teens, educators, experts, and parents, and a very special interview with Michael Phelps. Its goal is to help people identify and understand the symptoms of anxiety and encourage them to reach out for help. It screens to schools, communities, and theaters around the world. We have shown it in the Sequoia District quite a few times to staff and students and parents. So again, we think it's an important film. Please do view it when you get a chance. All right, let me tell you a little bit about our featured speaker today. Margo Thienemann, MD, is the Psychiatric Director and co-founder of the Immune Behavioral Health Pediatric Acute Onset Neuropsychiatric Syndrome, that's a mouthful, PANS Clinic at Stanford Children's Health. She is a clinical professor in Child and Adolescent Psychiatry in the Stanford University School of Medicine. Prior to this position, Dr. Thienemann founded the Anxiety Disorders and Obsessive Compulsive Disorder Clinics in the Stanford Division of Child Psychiatry. She is the author of numerous professional journal articles and book chapters on anxiety, OCD, and PANS. She attended Duke University School of Medicine and completed a residency in internal medicine at the University of Texas, San Antonio, and residency and fellowship in psychiatry and child psychology at the Stanford University School of Medicine. Please join me, everybody, in a really warm welcome for Dr. Margo Thienemann. Yay.
Thank you so much for asking me.
I'm sorry we can't be in a theater, so we can give you a big round of applause.
But thank you.
If you would, Margo, start by giving us a little background about yourself, what brought you to this work, and what you're seeing today in children and teens.
Well, I think I have a lot of experience with anxiety disorders, having grown up very anxious myself. It motivated me once I got into psychiatry to try to work with people with anxiety, and I've spent my whole career doing that. Anxious people are pretty wonderful patients to have. They are typically motivated. They want to be better. They want to feel better. They want to do things. And so it's a very rewarding thing to treat. And people can do so much better. It's very treatable. And so if you're trying to decide what to go into next round, I would recommend you do it too. I think that people think, oh, everybody knows what anxiety is. Everyone has been anxious, but which is good. It's important to be anxious in appropriate situations, like when a tiger is right there without a barrier. But it becomes a disorder when it's getting in the way of your life. Anxiety is normal and absolutely necessary. But for some people, and actually it's one of the most common mental health problems there is, people don't always get attention. More in child psychiatry clinics, it's more likely that children with behavior, like overt behavior problems, will get seen rather than someone who is pretty much sitting quietly being anxious. So I think that's one of the excuse me, important points about this movie is that it does point out that the problems in the teens and then kids they were showing who look to be highly functioning, regular teens really are suffering. And you couldn't tell it by just looking at them, that it's more hidden. So I think this film really does a service.
Well, thank you for pointing out that anxiety is normal in many situations. I think that will be a soothing thing for parents to hear. In that light, Dr. Thienemann, how do parents know if their child's behavior is within the norm of teen behavior or something where they might be seeking professional help? I think especially now I'm hearing from many parents who, after 3.5 months at home, we're all feeling anxious. How do you know as a parent when it's time to do something or seek help?
Yeah, ironically, I'll tell you what sometimes this COVID sequestering in place has covered up. One of the main not functional coping mechanisms for people with anxiety is to avoid things. So I've had a number of patients say, this is great. The expectations on me are much lower. I don't have to attend school. I don't have to go out. I'm not expected to go socialize. I'm not expected this summer to go out and get a job. So it may not be evident that someone is quite anxious because they're in their comfort zone of being home. So maybe this won't really be apparent, and maybe it's not as immediate a concern when we're not supposed to go out, but it will become so. And so it's good to, if you can detect it and work on it now, that's the best. I think chronically, kids are on a developmental trajectory, a certain path from, it's not a straight line, but from being developmentally from being a younger kid into an adult. And there are certain tasks they need to do along the way. They have academics hurdles they have to get through. They have social development. They have kind of internal development of who am I going to be as an adult, which is, ongoing process, of course. If you see them falling off that trajectory, becoming less independent, becoming less active and interested in things, socializing less, falling behind in their academics. If there's a sign like that, that they have ongoing, kind of chronically are drifting away from where they might be. Let's say you have social anxiety and you don't really go to the activities, you don't join a club, you don't try out for a team, you don't, go make friends. You will be drifting away from where you might be going as who you could be as a developed adult. That's an example. So chronically, if they're falling off that curve, but acutely, if suddenly anxiety gets worse, you might notice that kids have differences in their sleep, either sleeping too much, not enough, changes in their appetite, changes in their energy level. If they become more moody, more distractible, less motivated, not seeing their friends, then it could be that they're suffering from a bout of anxiety.
Well, thank you. That's a really great answer. So again, for those of you who are with us now, we are going to be talking today, Dr. Thienemann and I, about anxiety in children and teens. And if you have questions of your own, please do enter them in the Q&A button at the bottom of your Zoom screen. I have previous questions from parents, but we would be happy to answer your questions as well. So if you would type them into that Q&A button, we'll be watching that as we go forward. And my partner, Bev Hartman, is in the background also fielding those questions for us. All right, so for example, here comes a question from a parent. What do we do with a young child who does not sleep soundly? They wake up after a few hours and come into the parent's room, then they sleep on a mattress in our room until we bring them back. We've consulted with various therapists about sleeping issues and nothing seems to work. He's never been diagnosed with anxiety, but do you think that we should be taking more action? Thank you.
I think if you have tried the things that seem logical to you, but they haven't worked, I think it's worth getting consultation about it. Everybody needs sleep, parents and their kids, and without it, family functioning, personal functioning gets worse, and people can become irritable, and well, you know that story. I think that it's worth getting some therapy. People who treat anxiety disorders are trained with handling this very problem. It could be specific fears. Little kids have specific phobias, monsters, of course, the dark, uh, that kind of thing, burglars. And there may be other specific fears that you don't know about that maybe they feel comfortable talking to their parents, or maybe they don't feel comfortable talking to their parents. The thought about sleeping on a mattress in the room could be part of a solution. There's something called graded exposure therapy, where you might make a rating. How hard would it be if I slept in your room all night? How hard would it be if you slept in your room all night? 0 to 10. 10, no way. How about if I slept on a floor in your room? How about if I sat in a chair outside your room, till you fall asleep? You kind of slice through the different the scenarios that might be something in between sleeping in your own room all night by yourself and sleeping against me all night, and find where you might start in practicing and have a reward system. That's something that can really help, as well as exploring, well, what might noises be in the night? It could be the house settling. It could be a raccoon. It could be the neighbor coming home from their work shift. It doesn't have to be a burglar. And how often do burglars come? And what would we do if a burglar came? So I think both thinking about what someone's thinking and then working on their behavior are each pathways to help with anxiety. I hope that answers what you're asking.
Yeah, absolutely. Thank you. So again, here is a parent who asks, has COVID-19 increased overall anxiety in kids? My previously even-keeled teenager now seems more nervous, sensitive, and irritable, especially with his siblings.
It could be anxiety. It could be a number of things. I think kids are frustrated. They're not seeing their friends like they usually do. They have to attend to and pay attention in all day online classes, which I think can be really tedious, stressful, and maybe not the best way to learn. I think the kids have cabin fever. I think some of them, and nothing's black and white. It's nice to have some time with their family, but enough is enough. They can feel helpless and but also hopeful, seeing the Black Lives Matter protests, etc. But it's very impactful for most people. And if they tune into politics, that's stressful too. I've also talked to kids who are very sad about they planned for the prom. They don't get to have it. They plan for graduation. They don't get to have it. They're supposed to go to college. They don't get to go, or they don't know if they're going to go. Quite a lot of disappointments to deal with, especially at that age, and especially in our kids where so much of their life points to getting into college. And then what an anticlimactic thing this is, and how disappointing. So
Margo, you make such a good point there. We know that kids are disappointed, and you use the word frustrated, which is really an interesting one. As parents, we really want to fix things, but do you have a suggestion for a better way to handle a kid who's disappointed because they didn't get to graduate, they didn't get to go prom, they didn't get to have their spring tennis season, whatever it is?
yeah.
Is there a better way as parents than to try to say, you know what, honey, there's kids with real problems out there. What should we do? What should we do instead?
Right. Not going to set our crusts to people who don't have something to eat. No, that's not quite the answer. I think the most functional way I'm thinking about it these days is, can you look at all these frustrations and say, what are some things I can control, and what are some things I have no control over? And try to make a distinction, or let's say control over now. We don't want pessimism necessarily, but in this moment, what can you and can't you control? If you can't control it, it's good to empathize, accept it, and then problem solve about, well, what could we do on the things that we have some control of? You have some control over your thoughts, some control over your feelings, some control over your activities. So where can we move in that zone while we're waiting for some progress in the things that we really can't control now?
So you suggest talking with your kids about what some of those options might be. So put it out on the table, so to speak.
Yeah, and problem solve. So you can't see your friends. What could you do? Well, you could have virtual meetings, virtual parties. You could send letters. You could, I mean, and I would just make a list of 20 things. Some have to be silly, like, we could maybe we could leave things under rocks on corners and we both walk by it. I mean, I don't know. There are a million things, and I haven't thought of most of them. But it's time to get out the creativity and try to lighten up and have some fun. And it's very hard, especially in that time of life where adolescence is a go out and explore. Go live with your family with one foot in your family and one foot in your peer group. But wait, I have to stay with my family all day. That's developmentally a lot of tension because there's a lot of movement internally that wants to get out and have a private life, have an independent life, and we're also together.
Oh boy, that is really true. I feel for you, those of you who have parents of teenagers, because I know it's not an easy time. They want to be with their friends, they want to be with their partners, they want to be with their boyfriends and girlfriends. It's really hard. Here's one that a lot of parents ask, Margot. They say the apple doesn't fall too far from the tree. We know from executive producer Karen Gornick, who is responsible for angst, that she found out about her own anxiety while trying to get help for her son's severe anxiety. How much of anxiety is heritable? And what should parents be aware of when thinking about their own anxiety?
Well, there's good news and bad news about this. The good news is that though it's heritable, if you're an anxious child or teen, you may have a parent. You're more likely than most people, not destined, to have a parent who totally understands because anxiety disorders do run in families. Anxiety and depression run together too in families. So if you have a depressed parent, you may be more likely to have an anxious child. If you have an anxious child, you're more likely to have an anxious child or maybe a depressed child. Certainly, our genes are part of that. Girls more than boys and have anxiety disorders and mothers more than fathers, probably 2 to 1. That's just not understood yet why, but that's how it is. So it's more common in a family that the mother would be anxious than the father, but that's not universal. But it's not it's not just that your genes. Parents can model either anxious coping or anxious behavior. So if a parent would live life as though the world is a scary place, well, where do we learn most of what we learn? From our parents modeling how to be a human. So if it's too scary to go out to the mailbox alone, according to your parent, you will learn that's dangerous, right? That's a little silly example, but I think if a parent has anxiety, it's good to be mindful about what am I doing or avoiding out of anxiety and try to work on that. Or if you're not saying, oh, I'm so anxious about this, it doesn't make sense. It's an irrational fear. I'm working on it. I think it's also true that children can shape their parents' behavior. An example always has stuck with me of a family where the child and the family went in the van with another family to a fair, some sort of carnival. And the patient freaked out, really had a terrible time, very scared of all the noise, all the rides. and wanted to go home. And so both families had to go home. Well, you might imagine that the next year the carnival comes up, the child's behavior really did affect the family where they said, I don't think we'll go this year. And you could get into a pattern of avoiding things that might stir up the child's anxiety. So family behaviors can reinforce the anxious behavior if this could happen pretty much unawares, right? So it's a good thing to be aware about.
Thank you. That is really a lot to think about. We have two related questions to that, and I'm sure that other people are wondering about these too. Can you speak for a minute about how you tell the difference between introversion and anxiety in teens?
We hardly in psychiatry use the term introversion. I think, though, I think I know what it means, that what's the most interesting thing to you? What do you enjoy? Do you enjoy being out and socializing? Do you enjoy doing things by yourself? So that's an enjoyment thing. It's a preference. I think anxiety would be not that I would prefer to be by myself, but I'm really uncomfortable when I go be with other people, so I'm going to avoid it. So I think it's a matter of preference in extroversion, introversion. You have people who are extroverted who have social anxiety, so they really long for being around a lot of people, but they're just too nervous to do it, for instance.
Here's a very related question, again, that I know many people are thinking about. I notice my kids have lost passion for what they used to like from school, music, sports. They're uninterested in them and really just want to spend time online chatting with their peers or gaming. Is this something of concern given shelter in place and loss of school interaction?
I think it's worth trying to understand if I've lost interest in it because I'm scared versus I'm really enjoying thinking about this more than that. I think I hear a lot from anxious people, youngsters. Well, I'm not really interested in band next year. Well, what happened? Was there bullying? Was the performance expectation higher? Like they were asking me to do solos, or were the kids in the class not being very nice? I think if you can try to plumb and see what is the trouble, and if you feel like you're getting a brick wall but you think it's a problem, then you might find a therapist too, in case the kid will talk more with a therapist. I think it takes a lot of creativity to get people off screens. You know, they're designed to have a reinforcement schedule that keeps you going. So, and kids are more sensitive. Teens, their dopamine reward system is even more rewarding, right? This is why they take on risky behaviors a lot at that time of life. So it takes work, I think, to pull them away from screens and games. And I don't think it means they can never do it. It's part of their generation, and there can be a lot of good socializing in it. But I think that it's worth trying to keep them going in music, or I don't remember the other things that you said. Find out why. Find out why.
Find out why. Good advice. Always good advice. Talk to your kids. A parent asks, my child prior to COVID-19 really did everything she could to avoid school. I am so worried that it's going to be almost impossible to get her back in August when school starts up again. I've been hearing this from other parents who have kids with school refusal, symptoms that, as you said earlier, they're perfectly happy to be home and doing school on a screen, but that's not how it's going to go ultimately. So any advice for those kids who are content to not go to school?
Yeah. So I'll come back to what I was saying about why. A third of kids don't want to go to school, this is roughly, because of social anxiety. Another third have generalized anxiety about tests and performance and that kind of a thing. Sometimes they have an unidentified learning disorder. And, you know, it, or executive function disorder, like organizing and that kind of a thing. And so when, let's say you're in grade school, there's a lot of rote learning and memorizing that maybe the child can do better, just fine on. Once you start getting older and older, you're expected to do much more sophisticated synthesizing of information. So you take the information and manipulate it around and come to some conclusions. Well, if you have a learning disorder, reading disorder that was unidentified, you can really hit the wall. Or if you suddenly, when you have 8 classes to go to versus 1 classroom with a teacher that's known you really well, that kind of organizing can be overwhelming. So that's another reason. And there might be bullies. So I think it's important to find out. And like I said before, if you can't find out, then maybe get some help for it. I think school refusal is a hard thing to treat. I think it's important to look at oneself to say, is there anything I'm doing to reinforce their staying at home? It's not the time to have cocoa during the middle of the day, right? No TV. It should be kind of prickly, this is school time, when it's school time. But I do think it's worth, A, finding out what's the matter, and B, starting now to try to break the ice. Trying to, if it's social anxiety, what can you do to address social anxiety while we're sheltered? If it's generalized anxiety, if it's learning disorder, if it's bullies, try to work on strategies to deal with those so you'll be closer to be where the person can be when it's time to actually go back. Does that make sense?
Yeah, it does. That's great advice. Starting early, starting now. Again, connected to that question, here's a parent who asks, my 13-year-old has generalized anxiety and depends on people around him to do things for him. He thinks this is fine, doesn't want to do therapy himself. What can we parents do? He's become completely avoidant of social interactions outside the home, and frankly, this is getting tiresome for his parents and sibling.
Well, let me sure I've got the question. There's a lot of things there. So the child has generalized anxiety and they're really not doing much. Everyone's doing things for them. Maybe that means calling the teacher. Maybe it means trying to get excuse out of school. Maybe it's getting delays on tests. I'm not sure. I don't know. But generalized anxiety doesn't, like, it's not like general anxiety, like, oh yeah, everybody has it. It's where you really have anxiety that gives you headaches, stomach aches, trouble sleeping, irritable, achy, avoidant, thinking about anxious worries more of the time than not. If one accommodates, if one helps the person out of compassion, of course, and trying to be kind to avoid things, that won't help them in general. I think things that are within their grasp, things that are like a 1 to 3 out of 10 in difficulties, it's really important to help them keep doing those things. Maybe there are accommodations to make it a 9 or 10 while you're getting help. But I don't know if I listened to the whole part of the question.
Well, I'm gonna make 2 comments about that, Margot. One is you mentioned a rating scale, and for those of you who saw angst, there's a section in there where a young man named Max goes with his therapist to a ski shop and they try on clothes. And she asks him to rate his anxiety as they're getting out of the car. And he says, oh, about an 8. And then afterwards, she asks him to rate that again. Could you speak, if you would, about strategies for parents to guide their anxious child by encouraging them to plan and practice in stressful situations like that?
Well, what you're talking about is called either a fear thermometer or a subjective units of distress scale. I think it gives people a common language for how scary is that. How scary it is to eat ice cream cone 0. How scary is it when a dinosaur appears outside your window? 10, at least, right? So how scared is it to sleep over at your friend's house that you've never slept over? How about how hard is it to sleep over at grandma's house? So you try to get a common language on how frightening things are. And to have success, people work best a little bit out of their comfort zone, but not freaking out. You might lose your alliance with them and cooperation. So that's one tool. It would be called graded exposure therapy. So graded refers to the 0 to 10 scale, and exposure means be in front of the thing that you're afraid of. So you might start with a 3. He started with, was it 6 or 8? A high one, but I guess he was game. And he practiced it. You can either get desensitized, like used to it, used to the situation, or more modern CBT is looking at what did you expect would happen and what actually did happen. What was your, then you look for an expectancy violation. So, well, I thought they would laugh at me. I thought they say, what a geek you are. You don't know what to wear at all. You don't even know. Like, get out of here. Hey guys, look how silly this person is. But that didn't happen at all. So even though it was really scary, their fears were not realized. So that's another way to go about it. What do you think is going to happen? How scary is this? Let's go in and see. And then you say, bang, you did it. You tried hard. So proud of you.
So you suggest practicing with kids and maybe asking them to use this scale if they have something coming up. Say it's a virtual birthday party. You might say, Anisha, how are you feeling about this? Is that what you're suggesting?
Yeah, 0 to 10, how scary is this?
Okay.
And then there are different ways you can go to a virtual birthday party. You can dress up in a hat and have all sorts of, dance and stuff, or you could not show your face. I mean, there's a whole range of how you can make it more and less scary. So I would discuss that too. How long do you stay? Are you going to talk? Are you just going to hang out? Are you going to send a nice email, Instagram, whatever mode they use? Instead, maybe you're not. Maybe going to the party is way too hard, but what could you do to just kind of move away from your avoidant stance into a little bit of discomfort, but not so much that you can't do it? Okay,
I love that advice. You're actually taking the child with you in planning ways to address their own anxiety.
Yeah, I mean, adolescents are harder than younger kids. Younger kids, typically I have their parents in the sessions with me, and adolescents, it's hit or miss. Some want their parents, some don't. So you may be the right person and you may not be the right person to be
Fair enough.
The coach.
We're going to move into a couple of questions here from parents that have younger kids but are relevant to the overall discussion. Do you have any advice for an 8-year-old kid who has super low self-esteem and anxiety that seems to be partially stemming from self-imposed perfectionism? When something doesn't go his way, he doesn't get 100 on a test, he doesn't like how he drew something, he may have a tantrum or just say, I'm dumb. How can we help him to be more compassionate with himself?
I think it's worth making sure the child doesn't have depression. I think it's worth making sure the child doesn't have obsessive compulsive disorder, and perfectionism is just one of other obsessions and compulsions that maybe are hidden, to understand the scope of what you're dealing with. I think it's important to talk about how do kids get anxious. Well, you can't change the genes. Okay, you can change the modeling. Are you modeling perfectionistic behavior or not? So check that. And I think check one's talk about expectations is important. I think perfectionism is a difficult thing to treat. If it's in the context of depression or an OCD, often treating those problems, the perfectionism can be helpful. But when you work with someone like that, you want to say, well, what if it's not perfect? Well, often it's, then I really will hate myself. And that's hard. And I think that's something it's worth trying to get some help with.
Yeah, I think it's different, as you say, depending upon the scale. I had a daughter who tended to be perfectionistic and was warned so by her 8th grade teacher. And he said to her, Brittany, you don't need to work this hard. And she would say, but I want to. And finally now as a young adult, She's just learned that she needs to take extra time to do things that meet her expectations, but it doesn't interfere with her overall functioning. So there's a difference there, isn't it?
Yes,
When you start to worry.
and it sounds like she's learned to weigh what's the cost of this high standard I
Yes,
have versus the benefit. Right.
exactly.
And perfection is enemy of the good. We could all be much more perfect if all of our whole day and life's energy goes into this little sliver of a task. But what about the whole pie? Right?
Yeah.
We all have to be doing cost benefits of every time, everything, all day long. What if I exercise for this long? What if I eat this much? What if I spend time playing this game? We're always weighing, what are the priorities? What's the cost? What's the benefit? But that's a hard one.
That is great advice, though. So here's another question related to something you touched on earlier, Dr. Thienemann, a little more specific. Can you share tips on helping young children, basically 5 through 8 years old, adjust to school in the fall? I think masks and social distancing will increase their pre-existing anxiety. So how can we balance their safety with good mental health in young kids?
I have to say, I wish I knew the future. Well, I don't know if I want to know the future, actually. It's a curse Cassandra had. I don't know. I think it really depends a lot on the child and the situation. We don't know how it's going to go. I think it's back to like what we can control and what we can't control. In anxiety disorders, people tend to uh, exaggerate the probability of a bad thing happening. Like, if my mother's late, she probably was in a car accident. Well, that's not probable, it's possible. And how bad would it be? If she's in a car accident, how probable is it that would be fatal? Well, it's not probable. Maybe she had a fender bender, but maybe she stopped to get carry-out food. Maybe she forgot something at work. There's so many things, but how probable is it you'll get COVID? And if you get COVID, how probable of it will it be that you get very sick? Well, we don't know those probabilities, but I mean, I think our whole world is trying to move toward better understanding of that. We can control what we can, and as a family, together with your physician, figure out what risk seems reasonable.
Great advice. Thank you. Here's a parent who's asking, kind of in that vein, how do you know you need help? Within a second, my child can change from an angel to a monster if she doesn't get her way. Yelling at family members without respect, does not apologize for behavior, but socially at school, she's a model student. Is her behavior driven by anxiety?
It's possible. Is there something, is she being especially good at school and letting it all hang out at home? I don't know. It's a good thing to try to find out about. But another thing, the first thing comes to mind is there is any way that the household is inadvertently reinforcing this, the outburst. What happens? What is the trigger? What does the child do? And what does the environment do? And is there anything in the environment the environment response that makes that response more probable? Like, for example, sometimes with kids who swear, you would try, well, instead of getting freaked out every time you swear, make it a big deal, I've decided I'm just going to ignore it now and see how we do. And that's called differential reinforcement of desired behavior. So if you ignore it, it's not fun to tease anybody who doesn't react. It doesn't have much impact if you swear and nothing happens. I mean, you will have already had the speech about this is not appropriate, I don't approve of it, it's not good to do other places. So is there something about the tantrums that brings attention? Maybe it gets attention away from the other siblings. Maybe it's one thing that gets the parent off their computer. I don't know, but I think it's worth doing an analysis to see, is there anything that the child is getting that they need when they have the meltdown.
So you could actually do a test and even involve the sibling and say, you know, for the next 2 days, when Tessa melts down, we're just gonna go do something else. We're gonna pick up a book. We're gonna
Yeah.
talk to each other.
And I think it's important to tell the child herself, the child in question, because it might feel insulting, or they don't love me, or what you should say, honey, this isn't working out. It's not functional, whatever the right vocabulary word at her stage is. Functional behavior. I know you do okay at school. I'm just going to try something new. When you do this, we're not going to respond. Because that's more respectful, I think, to her.
Yeah. I really like that advice. It's the same advice we give parents who use tracking devices like on their kids' phones or tracking software, to always tell them in advance, because if you find something, then what do you do? How do you talk to your child? So I really love that you would give that preamble to the kid about, we're going to try something new. I sometimes ask my own children, or I remember doing this when they were younger, which is, you know, I'm really kind of out of ideas. I need your help to try to solve this problem, whatever the behavior was. And, you know, more often than not, they would come up with something, and at least they would know how I felt.
There's a really good book called The Explosive Child by Ross Greene that talks about this collaborative problem solving. And I think you're right on. I think working together, getting everybody's ideas is more fruitful.
Yes, absolutely. Here's a good question. Margo, I know you can speak to this one. Can you talk more about what treatment involves? What are some techniques that are often used by therapists?
Yes, I will tell you a list of techniques. One would be controlled breathing, learning kind of meditative yoga breath. When you're anxious, you can't easily control your heart rate. You can't, or the shakiness in your hands, or the sweating, or the butterflies in your stomach, but you can take hold of your breath. And so learning to take a breath, but learn how to control your breathing. Diaphragmatic breathing can activate your vagus nerve, which kind of slows things down in your nervous system in a healthy way. Progressive muscle relaxation is another very common tool. You learn how to tense your muscles and relax them, because we can carry a lot of anxiety tension in our musculoskeletal system. Cognitive work. So you've heard of cognitive behavior therapy. Cognitive means thinking about your thoughts. Okay, why am I afraid to go do that? Well, they'll probably throw water balloons at me. Okay, what's the chance of it? What's the probability? How bad would that be? Has it happened in the past? What would you do? So thinking about what you're thinking and try to problem solve and rationally respond. And then practice. Going to the party. Maybe you have a parent come with you. Maybe you ride with a friend. How can you modify this, but do not avoid the thing you're afraid of if it's inappropriate to avoid it, and try to move forward toward approach a problem, approach the feared situation.
Well, I can't believe our time has gone so quickly. Margo, you've had such amazing things to say. I'm going to end here with a couple more questions, okay?
Mm-hmm.
These are, again, sort of related, and then I think I'll take one last question from the audience, and then I will ask questions that we have from before. Here we go. Most parents today are very involved in their children's lives. When should parents step back, or when should they press their kids to handle things by themselves?
I think as parents, we're always striking a balance between that, right? We teach children to go to the toilet. Well, usually they're preschool teach them. Well, for my kids, how to brush their teeth. When do they get to stay home for 5 minutes? When do they get to cross the street? We're constantly trying to judge what is their judgment, what is their capacity. But I think one of my parents that I worked with had a great analogy. He said, eagles make this nest, and it's all twiggy. It's really uncomfortable, but then they put some down in it to make it more cozy. But as the kids get more older and older, well, the little birds, they pluck out the comfortable feathers, and it becomes a little bit less comfortable to sit there in the nest. And that's kind of an encouragement to take some more things on I don't know if that's answering your question, but.
No, I thank you. I remember getting that advice from a parent when my kids were younger. She said, "Oh yeah, senior year of high school, we call it soiling the nest. They're making sure that you are ready for them to go." All right. Speaking of this, I'm going to take this last question because I think this is a great one and it's a good way to wrap up. Many children who have not had problems with anxiety pre-COVID, we hope will be returning to school with anxiety. Not we hope for anxiety. We hope they'll be returning to school. May have anxiety for a number of reasons. How do you suggest teachers help them? I know this isn't necessarily in your bailiwick, but just your ideas on that.
I think they should be a lot like the parents and trying to say, here's what we know, here's what we have decided would be good rules, and come up with simple rules that maybe depending on the developmental age, there's a cute slogan you can come up with. But when kids feel anxious, they can come back to say, okay, 6 feet is sweet, or I don't use that, but just something that will ring in their ears to help them remember. No hands in your, I mean, they'll come up with something, but like if there are 2 or 3 rules that they can hang on to and feel like, and then we all feel like that's a reasonable, we're reasonably being careful according to how the CDC is telling us at that time. I think that would be helpful. I think it's good to share, but not too much. I don't think it's important to look at the refrigerated cars of bodies in New York with your children. I don't think that's helpful. Or just pictures of the ICUs. I hope this is a thing of the recent past, and I hope we're making progress. But I think it's important they have some information. But I don't want people to be watching the news uncensored with their children.
Thank you. That was really a lot of wonderful advice. Dr. Thienemann, we're so grateful to you. And for those of you who are viewing with us, please do check the chat stream. You'll see a lot of resources listed there. And also Dr. Thienemann has given us a list of books that we will send in a follow-up email to everyone. Today's event was recorded. If you or a spouse or a partner or your child would like to watch it, please do feel free to do that. So again, a huge thank you to Dr. Margo Thienemann for her expertise and warmth and compassion today. We could not be more grateful. So for all of you, I'm going to give a nice round of applause. Hope to see you soon. We have more events coming up, so look for details in the Parent Education Series newsletter. Thank you, everybody, and a big thank you to you, Dr. Thienemann.
You're welcome. That's very kind to say, and I hope I've said something that will help somebody here.
Absolutely. All right. Goodbye, everyone. Hope to see you soon.